Hello everyone, a very warm welcome to the Smart RN channel and thank you for logging in. My name is Henry. In our video today, we are looking at hypertension or high blood pressure. Hypertension is a rise in blood pressure above normal ranges. When our blood circulates in the arteries, there is pressure that it exerts against the artery walls. And when this circulating blood pushes against artery walls with more pressure than normal, we term it as hypertension or high blood pressure. Now, there are a number of factors that can expose one to high blood pressure. One, we have got age. High blood pressure tends to rise as we grow older. And this is because our arteries normally harden as we become older. So blood flows through these hardened arteries at a higher pressure than is normal. So the heart is forced to pump even more harder when pushing blood through these hardened arteries. Two, we have got gender. Now, both males and females have a higher chance of getting high blood pressure. But before the age of 65, high blood pressure is prevalent in males when compared to females. But after age 65, females tend to have more cases of high blood pressure when compared to males. But all genders can actually get high blood pressure. Race is also another factor whereby black people tend to have more cases of high blood pressure when compared to the white race. And in these black people, the high blood pressure cases can even develop at a younger age. So high blood pressure is more prevalent in black people when compared to the white races. High blood pressure may also be familial. In other words, it may tend to run in families. Now you find that if your parents or your siblings have got high blood pressure, then you have a higher chances of developing high blood pressure. It tends to run in family. So family history is also another factor that can expose one to high blood pressure. We have obesity or overweight. Increase in weight is another factor that can cause high blood pressure in an individual. And this is because increased weight normally results in changes in our blood vessels and especially the arteries. So the heart is forced to pump even more harder through these arteries of an obese person when compared to people of normal weight. So obesity or overweight is another factor that can cause an increase in blood pressure in an individual. We have got lack of exercise, dormant lifestyle. When we lack to do exercise, we gain weight. And when we gain weight, our blood pressure tends to rise. We have got smoking and tobacco use. Now, tobacco use on its own can cause short-term increase in high blood pressure. After using tobacco, immediately you find that your blood pressure can rise. But smoking as a habit normally causes the hardening of blood vessels, especially the arteries. So when the arteries are hardened, then we require more pressure to push blood through these hardened arteries. So smoking is a factor that increases high blood pressure. We also have diet and especially salt intake. Now, salt promotes the retention of fluid in our bodies, and the retention of fluid results in increased vascular volume. There is more volume in our blood vessels. So the heart is tend to pump even more harder to push this large volume in our vascular system. So salt promotes water retention in the body or fluid retention, and this causes high blood pressure. There is dyslipidemia. Dyslipidemia is increased fat and cholesterol levels in our bloodstream. And these fat and cholesterol levels normally result in the development of what we call plaques. and the plaques normally obstruct the flow of blood in our blood vessels. So high blood pressure will develop so that blood can be moved across this obstruction that is caused by plaques in the bloodstream. So dyslipidemia is increased fat levels and cholesterol levels in the bloodstream that cause the development of plaques that may obstruct the flow of blood within the blood vessels. Then we have got low potassium levels. Low potassium levels promote the retention of salt in our bodies. Remember, when we take more potassium in our diet, it promotes the excretion of salt. But low potassium levels will promote the retention of salt. And we have seen that salt normally promotes the retention of fluid, which increases vascular volume that results in high blood pressure. Excessive alcohol use. 10 grams of alcohol can cause an increase of 1 millimeter of mercury in blood pressure. So when we use alcohol excessively, we end up promoting or increasing our blood pressure. So excessive use of alcohol promotes blood pressure. We have stress. Stress as a condition on its own can increase blood pressure. When you are stressed because of one thing or the other, you find that your blood pressure goes up. Stress normally results in behaviors like smoking, alcohol use, or even overeating, which will result in increased blood pressure. Then we also have chronic diseases. There are chronic diseases that can result in increased blood pressure. For example, renal disease. This is kidney disease. Our kidneys regulate the amount of fluid in our bodies. So when they are not functioning well, then we tend to accumulate fluid in the vascular system, and this increases our blood pressure. Diabetes is also another one that can cause increased blood pressure. We also have heart disease. If the heart is diseased, then we can also have high blood pressure. So chronic conditions like renal diseases, heart disease, and also diabetes can result in high blood pressure. Then we also have got pregnancy. This is pregnancy-induced hypertension. These pregnant women normally develop high blood pressure after week 20. You find that they have normal high blood pressure, but in week 20 of pregnancy, their blood pressure is elevated. So that is what we call pregnancy-induced high blood pressure, or in a condition referred to as preeclampsia. Now, after delivery, these women may go back to their normal blood pressure, but some of them will end up having high blood pressure even after delivering their baby. So pregnancy is another condition that can expose one to high blood pressure. Now, there are two classifications of high blood pressure. One, we have got essential or primary hypertension, and two, we have secondary hypertension. Essential hypertension accounts for 90 to 95% of all the hypertension cases. And this is hypertension that cannot be traced to any particular cause. It is hypertension that develops in a person, and we cannot be able to attribute it to any cause in that particular person. Now, it is thought that this hypertension is as a result of the interaction between genetic factors and environmental factors. For example, the interaction of genetic factors and environmental factors like smoking, alcohol use, weight gain, all these factors can interact to bring about essential or primary hypertension. Otherwise, it is hypertension that cannot be attributed to any cause in an individual. And sadly, this is hypertension that accounts for 90 to 95% of all the hypertension cases. Secondary hypertension is that hypertension that can be traced to a particular cause in an individual. For example, secondary hypertension can be due to renal disease or kidney disease. Remember, we say that our kidneys are the ones that regulate fluid volume in our bodies. And when they are damaged or when they are sick, then we tend to accumulate fluid in our vascular system, resulting in high blood pressure. Then we also have Cushing's syndrome. Cushing's syndrome is that condition where you have got excess cortisol in our bodies. For example, you see these people have conditions like a round face, they have got a buffalo hump, they also have got very thin legs and thin hands, they also have got abdomen discoloration, referred to as abdominal striae. These are conditions, or these are signs and symptoms of the Cushing's syndrome. So these people normally tend to have high blood pressure. Then we have got hyperthyroidism. These are elevated levels of the thyroid hormone in our bodies. Remember, elevated levels of thyroid hormone will result in the elevation of almost every activity in our bodies. It is going to be on the higher side. So even blood pressure is going to increase as a result of hyperthyroidism. Then we have got myxedema. Myxedema is dangerously low levels of the thyroid hormone in our bodies. So it also leads to blood pressure. Then we have contraction of the aorta. Remember, the aorta is the major vessel that comes out of the left ventricle and it sends blood to the rest of the body. When this aorta is contracted, then the heart has to pump even more harder to push blood through it. So contraction of the aorta results in high blood pressure. Then we have got corticosteroids. When people are using steroid medication, these medications promote the retention of salt, which promotes the retention of fluid and also other electrolytes in our body. So this retention of salt and thereby retention of fluid in our bodies result in high blood pressure. So if you are under treatment and you are using corticosteroid, especially for those immune conditions, then you are likely to have high blood pressure because these steroids are going to promote the retention of water, which increases our vascular volume. Cocaine and generally drug use will also promote blood pressure, and cocaine normally results in the hardening of our blood vessel, contraction of the blood vessels and especially the arteries. And when they are contracted, then the heart must pump even more harder to pump through these particular vessels. So those are the two classifications of hypertension. But remember, essential hypertension is the one that accounts for most of the cases of hypertension, and we cannot be able to trace the cause of this hypertension in individuals. Now, blood pressure is expressed in units known as millimeters of mercury. And when we take our blood pressure readings, we normally take two numbers. One, we have got the upper number, which denotes the systolic blood pressure, and the lower number that denotes the diastolic blood pressure. So if you have a number like 120/80, 120 is the systolic blood pressure, the upper number, and 80 is the diastolic blood pressure, or the lower number. Now, systolic blood pressure is that pressure in the arteries when the heart pumps or when the heart beats. When the heart pumps blood, there is that pressure that is exerted against the artery walls. That pressure is known as the systolic blood pressure. And diastolic blood pressure is pressure in the arteries when the heart is resting, when the heart is not pumping. That is called diastolic blood pressure. So systolic blood pressure is pressure when the heart pumps, and diastolic blood pressure is pressure in the arteries when the heart is at rest. Now, we have just said that blood pressure develops when the pressure in the arteries is above the normal ranges. So what are the normal ranges of blood pressure? Now, normal blood pressure is where systolic blood pressure is less than 120 and diastolic blood pressure is less than 80. So when your systolic blood pressure is less than 120 and your diastolic blood pressure is less than 80, then that one is normal blood pressure. But low blood pressure is when the systolic blood pressure is less than 90 and the diastolic blood pressure is less than 60. So you have to note this, that normal blood pressure is systolic less than 120 and diastolic less than 80. Remember, I'm using the word and. But when systolic blood pressure goes below 90 and diastolic blood pressure goes below 60, that is low blood pressure or hypotension. So normal blood pressure is when our blood pressure is less than 120 and the diastolic blood pressure is less than 80. Now, prehypertension is systolic blood pressure between 120 to 139, or diastolic blood pressure is between 80 to 89. Prehypertension, systolic blood pressure ranges between 120 to 139 millimeters of mercury, or diastolic blood pressure ranges between 80 to 89 millimeters of mercury. So when your blood pressure is between these ranges, then we say you are having prehypertension. Stage 1 hypertension is when the systolic blood pressure is between 140 to 159 millimeters of mercury, or diastolic blood pressure is between 90 to 99 millimeters of mercury. Stage 2 hypertension is when systolic blood pressure is above or equal to 160 millimeters of mercury, or the diastolic blood pressure is above or equal to 100 millimeters of mercury. Remember, for these three stages, prehypertension, stage 1 hypertension, and stage 2 hypertension, I've used the word or, meaning that if any of these, either systolic blood pressure or diastolic blood pressure is within that ranges, then you are having that denoted condition. So those are the values for our blood pressure readings. And normally we request or we advise that you be monitoring your blood pressure now and again to know whether you have got high blood pressure or you have got normal blood pressure. What are the signs and symptoms of hypertension? Now, hypertension is known as a silent killer. In other words, it does not have signs and symptoms. So many people have got hypertension, but they are not aware of it. And that's why it is referred to as a silent killer. There are symptoms that may develop when your blood pressure has increased to dangerously higher levels. And some of these conditions are severe headaches. You may develop sudden severe headaches, or you may develop nosebleeds. We can also have vision problems, and that's due to hypertension retinopathy. This is where you have got blood vessels in the eye being affected by blood pressure. So you begin to have blood vision or loss of vision. All these are as a result of hypertension retinopathy. So when you begin to have vision problems, then that means your blood pressure has increased to dangerously higher levels. You may also have irregular heartbeats. You may have dizziness and even shortness of breath as a result of pulmonary hypertension. This is hypertension or increased blood pressure in the arteries of the lung. So these are some of the conditions that may develop only when your high blood pressure has reached very high levels. And remember, we have said it is a silent killer. You cannot know that you have got hypertension or high blood pressure unless you monitor it. And the earlier you know, the better, because you can start to take medications to be able to control this particular hypertension. Now, before we go further, we looked at risk factors for hypertension or blood pressure. We can divide those risk factors into two. We have got modifiable risk factors and non-modifiable risk factors. Non-modifiable risk factors are those that we do not have control over. For example, we do not have control over age. We do not have control over our genders. We do not have control over our races. Those are non-modifiable factors. But there are factors that we have control over. These are known as modifiable factors. We can modify these factors to either bring down our hypertension or control it. For example, lack of exercise. We can start undertaking exercise. Diet. We can reduce the consumption of salt, or we can also reduce the intake of fatty foods so that we do not have higher levels of fat and cholesterol in our bodies. So those are modifiable factors. So there are those factors that you can modify, and there are those factors that you cannot be able to modify. So when you check your blood pressure now and again, you can be able to know what factors are contributing to high blood pressure, and you can work on those factors that are modifiable. And that's why it is very, very important to start monitoring your blood pressure. But remember, very big thing, it is a silent killer. It is a silent killer because you do not have symptoms. And when they start appearing, then that shows that it has gone to dangerously higher levels. Now, what are the complications of hypertension? Now, as we have said, hypertension is a silent killer. In other words, it can actually result in the damage to our organs in the body without us realizing. So when you have hypertension, it damages what we refer to as target organs before even the symptoms appear. And the target organs we are talking of are the heart, the kidney, and the brain. These are the three major organs that are damaged by hypertension even before symptoms appear. Remember, the heart is the one that is pumping blood. Now, because of hypertension, it is forced to pump even more harder. And this results in what we call hypertrophy. The cells of the heart is forced to enlarge because of that overworking. It grows enlarged, and as a result of this, you are going to have heart failure, because at some point, this heart is not going to work effectively because of enlarging cells. So we have got heart hypertrophy. Then we also have got kidneys. Blood supply to the kidneys might also be impacted because of this artery. The arteries are going to be damaged. And when they are damaged, then our kidneys are not going to be perfused properly. And this can result in kidney failure. Now, there's another thing. What happens is that when the kidneys sense decreased blood supply, they assume that this decreased blood supply is due to low blood pressure. So what do? They release an enzyme that is known as renin. This enzyme is intended to increase the blood pressure so as to increase perfusion to the kidneys. So look at this scenario. The blood vessels are damaged. We are having a decreased blood supply to the kidneys. The kidneys are releasing renin to increase the blood pressure even further, and therefore complicating that particular problem. So the kidneys are normally damaged as a result of blood pressure. And even brain. Our brains can be damaged, especially as a result of hemorrhage in the brain, resulting in this particular damage the brain. So these are the target organs that are normally damaged by high blood pressure even before the symptoms appear. So that's why it is very important. Monitor your blood pressure. It is very, very important. Another complication is stroke. Now, stroke will happen when there's a rupture of blood vessels in the brain. Remember, there's high blood pressure in the vessels. We might have rupture of these blood vessels and causing hemorrhage or flow of blood in the brain, outpouring of blood in the brain, and this can actually cause problems. And then we have got hypertensive crisis. high blood pressure can result in a hypertensive crisis. Now, a hypertensive crisis is an acute and severe blood pressure elevation. Acute means it happens within a very short period of time, and also it happens abruptly. This is an abrupt rise in blood pressure. And hypertensive crisis, when the blood pressure rises to levels of 180 over 120 or more. This is a very dangerous blood pressure. Remember, when the heart pumps 180 millimeters of mercury, when it is resting, the blood pressure is still high, 120 millimeters of mercury. So 180 over 120 is an acute rise in blood pressure and is termed as a hypertensive crisis. Now, hypertensive crisis might be in two forms. There is hypertensive urgency and hypertensive emergency. Now, hypertensive urgency is when we have an acute elevation in blood pressure but without target organ damage. We do not have any symptoms of damage to those three organs we have looked at. And hypertensive urgency may include both the systolic blood pressure and diastolic blood pressure. But diastolic blood pressure rising to above 120 millimeters of mercury without target organ damage is referred as hypertensive urgency. And hypertensive emergency, when we have a rise in blood pressure with evidence of target organ damage. It can be both systolic and diastolic blood pressure. But diastolic blood pressure may be over 120 millimeters of mercury with the target organ damage. Remember, this diastolic blood pressure is when the heart is resting. So even when the heart is not beating, the blood pressure is very, very high. That is hypertensive urgency if there is no target organ damage, or hypertensive emergency if there is target organ damage. But remember, hypertensive crisis is an emergency. You need treatment. You need to go to the hospital so that you can be treated or your blood pressure can be controlled. And hypertensive emergency can result, as we have said, there is stroke, there is papillary edema, there is heart failure, there is aortic dissection. All these can be result of this particular hypertensive emergency. Now, how do we treat high blood pressure? We can treat high blood pressure using a number of medications. One, we have got diuretics. Diuretics are those medications that help us to decrease the fluid volume from our vascular system. In other words, these diuretics are those medications that cause us to decrease the amount of fluid in our bodies. When you get this medication, you find that you are urinating a lot. You urinate a lot to remove that fluid in our bodies. You have heard people talking about water pills. These are diuretics. And a good example of a diuretic, we have got furosemide. We also have got hydrochlorothiazide. These are medications that cause people to pee or to urinate a lot, removing or decreasing the amount of water in the body and thereby decreasing or controlling the blood pressure. We also have calcium channel blockers, and from their names, these are medications that block the calcium channel, thereby preventing the movement of calcium across cell membrane, and this one reduces blood pressure or controls blood pressure. Then we also have got ACE inhibitors. Now, ACE inhibitors are those medications that prevent the formation of angiotensin II. Angiotensin converting enzyme inhibitors. Their work is to prevent the formation of angiotensin II. And also, we have got angiotensin II receptor blockers. These medications block the action of angiotensin II. So these medications, ACE inhibitors, prevent the formation of angiotensin II, and angiotensin II receptor blockers, or ARBs, normally prevent the action of angiotensin II. We shall look more at these medications when we are looking at the RAS system. We have got the renin, angiotensin, aldosterone system. This is a system that increases blood pressure. So ACE inhibitors prevent the formation of angiotensin II, and angiotensin II receptor blockers block the action of angiotensin II, thereby controlling blood pressure. And then we have got beta blockers. Beta blockers are those medications that block or prevent the action of adrenaline. So what they do is that they bind to the receptors of adrenaline, and because adrenaline is now blocked, then its action is prevented, and thereby blood pressure cannot be increased as a result of beta blockers. And then we have got vasodilators. In most cases, these medications are vasodilators. Why? Because they end up dilating the vessels for blood pressure to decrease. But we have got direct vasodilators, which are medications that directly dilate our blood vessels to reduce blood pressure. For example, we have got hydralazine. Those are medications that are direct vasodilators. So all these are medications that can be used to treat hypertension. Now, in most cases, when you are diagnosed with hypertension, your doctors will try to start with diuretics. They start with medicines like furosemide or hydrochlorothiazide to try and bring down your blood pressure. So the doctors are going to assess your condition and see what medication is right for you. But remember, before you reach these levels, try to monitor your blood pressure and work on those modifiable factors that we can work on to try and bring our blood pressure down. For example, modifiable factors, I've said, for example, diet, reduce the salt consumption, have regular exercise, do not lead a dormant life, stop smoking. We said smoking normally results in our vessels, our arteries constricting or hardening. So stop smoking, reduce or stop alcohol consumption. Those are modifiable factors that you can work on to try and bring down your blood pressure. So what are the nursing interventions when caring for those patients with hypertension? One, nurses perform assessment. You always assess these patients. You assess their vital sign, assess the blood pressure, assess the blood pressure of this particular patient, assess the heart rate. You can also assess the optic funda. Remember, the funda is that back area of the eye, and it has got retinal blood vessels. And remember, we have said that when you have got high blood pressure, it is going to affect our vision. We might end up having blurred vision or even vision loss. So what you do, we assess our funda just to observe those particular blood vessels in our eyes to see if there is any bleeding or there is any vision loss as a result of this particular blood pressure. Then assess the labs. Monitor the lab values from this patient. Normally, look at the creatinine. Look at the creatinine, look at the BUN, blood urea nitrogen, and also look at the glomerular filtration rate. These three values are going to tell you more about the kidney. So if the kidney is damaged, then these values are going to be very high, because the kidneys are the ones which are used to clear creatinine from our bodies, the urea from our bodies, and even the glomerular filtration rate is going to indicate the functioning of our kidney. So when the kidneys are damaged, then these two values, the creatinine and BUN, will go up, and the glomerular filtration rate is going to go down because they are not working properly. So look at the labs. Monitor the labs of this patient to be able to know what is the effect of this blood pressure on the kidney. Then as a nurse, we also administer our medications. These patients are going to have medications which have been prescribed by the providers. So we administer those medications on time and in the right dosage. Then teaching. There's a lot of teaching nurses can do when caring for hypertension patients. For example, you teach these patients about medication adherence. This is very, very important. adhering to the medication regimen prescribed by the provider. Teach these patients that taking their medications on time and in the right doses is very, very important. And also teach them that when you realize that you have missed a medication, take it the first thing when you remember, and do not double the doses. Only take that dose which has actually been prescribed. So remember to teach the patient to adhere to the medication regimen. That is very, very important. Another thing is that do not stop taking this medication without the advice of the prescriber. Never stop taking blood pressure medications without advice from your doctor. So you are going to teach these patients medication adherence. Then teach them about lifestyle changes. How can you change your lifestyle to impact or to reduce or to help manage your blood pressure? For example, teach them about exercise. They need to exercise regularly. They need to stop smoking. They need to limit alcohol intake. They need to reduce salt intake. All these are lifestyle changes that can be incorporated into the lives of these particular patients to manage or even reduce the blood pressure. So as a nurse, teach these patients about the lifestyle changes. Also teach them about the signs and symptoms of increased blood pressure. For example, teach them about the signs of a stroke, because a stroke is one of the complications of blood pressure. So if they know those particular signs, they can be observant to seek medical attention when they develop those particular signs. Teach them about target organ damage. For example, you can teach them about kidney damage. When our kidneys are damaged, we have got fluid retention. Our labs, our creatinine, our BUN is high. So teach these patients about the signs and symptoms of stroke, the signs of target organ damage, and this will go a long way to help them seek medication when they face this particular condition. So those are the interventions that as a nurse you can take when caring for patients with this particular increased blood pressure. As always, please drop a comment, like this video, and share this video. And please, if you have not subscribed to this channel, please do so. And from me here today, it is a goodbye.